My name is Sorin Pislaru. I'm an associate professor of medicine at Mayo Clinic in Rochester, Minnesota. I just presented at the International Academy of Cardiology on bioprosthetic valve thrombosis. This is a condition that we increasingly recognize in a number of our patients, and we want to bring this to the attention of the cardiology community. There are three issues to this. First is, does the condition exist and when does it occur? And there's a common misconception we noted in our research that bioprosthetic thrombosis occurs perhaps early in the disease. In our own practice, we noticed that, in fact, bioprosthetic thrombosis occurs mostly late after implantation, with a median time to occurrence of about 2 years. The second issue is how you diagnose it. This is tricky, and people think that it is easy to recognize by echocardiography or by clinical findings. But in reality, when we reviewed over 50 cases of bioprosthetic thrombosis, we noted that transthoracic echo identified this as a potential diagnosis in perhaps 5% of the patients. Transesophageal echo did not do any better, and the reason for that, we believe it's related to the cardiology community being unaware of this possibility. When we proposed 3 criteria for how to diagnose it, meaning 1, having an increased gradient over 50% over baseline, having leaflets that have restricted mobility or are thickened. So these 3 criteria, when we apply them retrospectively for our series, we notice that the sensitivity and specificity is very good in diagnosis bioprosthetic thrombosis. The third issue that we wanted to bring up is how do you treat it, and that comes down to whether you do use vitamin K anticoagulation or whether you should send patients to surgery or lytics. And in our experience, really, the two are just as good, and if your patient is stable from a hemodynamic standpoint, probably you should go for the less invasive option of treating them with warfarin anticoagulation for a while and then see if they have an improvement. Finally, the topic of bioprosthetic thrombosis is going to increase being in the media, mostly because now it is noted in patients undergoing transcatheter aortic valve replacement, with reports from the CT groups demonstrating thrombosis in as many as 3 to 5% of the patients. We feel that this is going to be a big issue in the future.